Good afternoon and welcome to CJS News Facebook Live. Today's subject is mental health in young people here in Wales. It's been a huge talking point over the past year, but as secondary school children approach a year of online learning, has their mental well-being been protected? We are joined today by mental health activist, writer and broadcaster Natasha Devon, member of the Welsh Youth Parliament, Ffion Griffith, and a member of the Senedd for Newport East, John Griffiths. Thank you to you all for being here today. And for those of you who are watching us live on Facebook, feel free to ask a question to our panel in the comments section below. Before we get started with the questions that we have for our panel, Mark Drakeford said in a press conference earlier today that primary school children will be back for face-to-face teaching by the 15th of March, but we still have no timetable for secondary schools. Ffion, you're in secondary school at the moment. How do you feel about this news?
Yeah, it's certainly a difficult one because I can understand the reasoning behind getting young people back into primary schools because, of course, you know, there's all the issues around childcare with regards to opening back at different jobs and different things. But I really do see some sort of need to set out a path for secondary schools, as it's so important for us young people to get back to school, particularly for our mental health, because we rely a lot not only with regards to the academic sense of our mental health in schools, but you know that idea of being able to see our friends, being able to use that as a way to better our mental health and also gain the support we need face-to-face from teachers. You know, there's a big difference between just simply emailing someone about some problems you may be facing and going and speaking to them face-to-face.
Figures released by the ONS say when pupils briefly returned to school after the first lockdown in September, more than 70% of them had poor mental health. Last year, we also saw a 10% rise in the number of young people with a mental health condition compared with 2017. Natasha, as someone who does a lot of work with young people and their mental health, these are certainly concerning trends. Are we facing a hidden pandemic?
Well, I think it's really important to acknowledge that it for so many different social issues, the pandemic has just exacerbated problems that were already there. And children and young people's mental health has been worsening for a decade now. And it's also been severely underfunded for a decade. We only give about 6.7% of the overall mental health budget to children and young people services. And that's despite the fact that 50% of mental illness manifests by the age of 14. So that doesn't make any sense, particularly when you take into account that the earlier you catch something, the easier it is to manage it and treat it. So I would say that what we're seeing now is the consequences of those services being underfunded. And I feel like certainly with the kind of media narrative and the public narrative, it's all been about getting children back to school or coming out of lockdown, rather than looking at what is it that we can do to support children and young people through this difficult pandemic, through this lockdown? What do they need in terms of resources and funding? And also, what will they need in the future as we go back to the new normal?
John, as a former deputy of both education and health and social services, the Welsh Government is giving an extra £9 million in funding to youth mental health support across Wales. How exactly is that money going to be spent?
Well, around 4 million of it will go to schools because it's really important that we have better mental health services and support in our schools. And I think, you know, that's absolutely right, because, you know, there has to be a focus on getting our children back to school, our young people back into education as soon as we safely can, but also making sure that whatever support they need while they're there is in place. You know, I do think it's really important to get our schools back, and indeed our colleges, because I know from many parents who contact me and young people that their mental health is suffering because they're not in school, they're not in education, and also they're not taking part in the activities and interests that they would normally be pursuing. So, you know, I really do think that we need to have that return as quickly as we possibly can. It's difficult to give timetables, I think, because of the unpredictable nature of COVID-19. You know, it's worse really to set out a timetable and then find that you're unable to adhere to it and have to dash people's expectations than to proceed cautiously and, you know, wait until you're in a position to state something with some degree of confidence. So, you know, we're in such an incredibly difficult time, aren't we? And the impact on people's mental health, people of all ages, and then with the significant aspects that apply to young people, it's entirely right that more resources made available and identified. And I'm really pleased that that £9 million plus has been added to the funding that was already in place, and that that £4 million is specifically available to schools.
Natasha, we know that CAMHS is something that is very important to you, but we also know that it is incredibly oversubscribed. Will this £5.4 million, which the Welsh Government has pledged for CAMHS in Wales, actually make a difference?
It's so difficult to say. I think part of the problem is that mental health, or the term mental health, covers such a broad remit of potential conditions and issues. And you've got prevention stuff, which can be done within schools, within communities, within families. You've got the needs that only CAMHS can cater for. And then you've got this kind of sandwich issues in the middle, which are over and above what maybe a teacher could help with, but they're not something that would fall within the remit of CAMHS either. And something that I'm really pleased about in Wales that we don't have here in England is there is a school counsellor in every school. We don't have that here. That's the kind of thing that you need to see to kind of cater for those young people who they are struggling, but they don't meet the thresholds. So the problem is that, as you say, CAMHS is so oversubscribed that the thresholds keep rising. So now you need to be in really significant distress to even qualify, in inverted commas, for an appointment to get to services.
Ffion, just a few months ago, the Welsh Youth Parliament wrote a report about mental health. Is this announcement of new funding good news in terms of CAMHS? Yeah,
we as the Welsh Youth Parliament really wanted to highlight the need for better funding, the need for more funding, and for things such as CAMHS and that, because of their importance to young people. And it's really great to hear that there is more funding. But one thing we did really want to highlight was not just the need for funding and money to be pumped into different things like CAMHS, but the urgent need for these to be these mental health facilities and stuff to be reviewed. We really think it's important that we understand, the weaknesses and the strengths of our mental health services in Wales, and that we're actively working and continuously working to better them, that we're not falling complacent with the way things are, and not simply saying that, mental health, we've put some money to it, so it's done. It's about constantly reviewing, constantly analysing, and constantly listening to the young people of Wales and listening to their needs, and adapting services to fit their needs, rather than sort of pushing young people into services and adapting the young people for the services. It's about doing it that other way around.
If you're just joining us here at CJS News, we are joined live by Natasha Devon, Ffion Griffith and John Griffiths, discussing mental health of young people here in Wales. Again, if you would like to ask a question to our panel, feel free to do so in the comments section below. We actually have a question from Jackie Crowley in Cardiff. She's suggesting secondary pupils going back on a shift pattern, so they have less time in school but more social interaction. John, is this possible, what Jackie is suggesting?
Yes, I think it is, because Mark Drakeford, as the First Minister, and Kirsty Williams as the Minister for Education, have talked about a number of possibilities in terms of the return to education. Pupils going in part-time for particular days or for parts of days, and then maybe splitting up the school week or school days into different component parts, some of which might involve more social interaction rather than formal education as we are used to it. So, a whole range of possibilities have been discussed, and there have been endless meetings really between Welsh Government ministers, officials, local authorities and the teaching unions to try and find the best way back to schools, back to a return to education. And, I know that work and those meetings are ongoing. So I think that will continue, and all sorts of possibilities are being discussed, and I think ideas are welcome.
We've also had another question from social media. It's from Chloe Scott on Instagram. She is campaigning for dedicated mental health nurses to run community wellbeing hubs with a focus on building holistic measures into the NHS. Do you guys think that children would benefit from this? Natasha, if you don't mind, I'd like to start with you, please. Is this something that would benefit local communities?
Well, I think that that's a really worthwhile campaign, Chloe. And I think part of the problem is that mental health training is a tiny component of what medical professionals have to do in terms of their mandatory training. So if you look at GPs, for example, 1 in 3 GP visits is for a mental health issue. And yet the chances are when you go to see your GP that the amount of training they've done specifically in mental health is quite minimal. So that creates, because GPs are kind of the gateway to getting specialist services, that can create a kind of pile up or not getting the correct response. So I think having community hubs where you have people like mental health nurses who have that specialist knowledge and can almost be a kind of bridge between other services within that community would be a really useful thing.
Are we now reaching a point where it's become more dangerous to keep children out of school than send them in, given the impact that it's having on their mental health? Ffion, I'd like to hear your perspective on that.
I think, again, this is a really difficult one because, as we talked, mental health is so broad, and there are a lot of things that can contribute to people, not only developing mental health problems, but feelings of, low feelings. And I know a lot of young people have been worried about going out and going to schools and stuff and contracting the virus and passing that on to perhaps vulnerable members of their household and older people in their household. And we're at a current point with the vaccination where, yes, a lot of older members and vulnerable members of our society have, but people's perhaps parents haven't. I've got, neither of my parents in my household, I can speak from personal experience here, have had the vaccine because they're not yet in one of the main groups that are receiving the vaccine. And of course, completely understand that. But there is that worry then that I'm going to go out and I'm going to pass it on to them, and they might be seriously ill. As we know, the coronavirus doesn't perhaps discriminate against people with regards to who it negatively affects and different things. And so it is definitely a difficult one because, yes, young people's mental health is suffering and it's having a really detrimental effect on some young people. But there is also that sort of other side to it then that perhaps, people going to school and being around the coronavirus can also, stimulate anxiety within young people.
John, would you be able to provide a government perspective on that question?
Yeah, I think, there are many incredibly difficult balances to be struck in making decisions around the response to COVID-19. And I think that's one of the biggest, really. Personally, I think that we do need to get our children and young people back into school and education as quickly as we possibly can. And Welsh Government has said, in common with other administrations across the UK, that it must be one of the very top priorities, but it is a balance of risks and a balance of harms. And, I think one thing that Welsh Government has been very clear about is that in weighing up the different considerations on these matters, until we effectively drive down infection and cases and ease that pressure on the NHS, we're never really going to be in a position to have any return to any sort of normality. So, if you deal effectively with coronavirus, then you deal effectively with all the other issues that are involved. So I think, we must understand that. But if we could drive down infection and cases, but at the same time deal with other top priorities without harming that effort to deal with the virus, then that's very much to the good. And getting schools back and our young people back into education is the very top priority, I think.
If you don't mind me asking, John, how do you do that safely and without pressurising the NHS? Well,
I think among the meetings that I referred to earlier between Welsh Government ministers, officials, local education authorities and the teaching unions, I've centred on that, how you can return to school and education most safely. And funding has been made available for greater security measures and safety measures. So, that has been addressed, and it's a matter of, you know, getting agreement really between those various players as to how you really can deal with risk and drive it down to the lowest possible level. We've already seen various measures around social distancing and hand washing and mask wearing and so on, but additional measures will also be in place after these recent meetings and talks.
Thank you, John. I'd also like Natasha's view on this question as well. Natasha, are we reaching a tipping point at this stage?
Well, I think I want to pick up on what Ffion said actually about, I think too often it's presented as this binary choice between physical health and mental health. If we're locked down, mental health suffers. If we're not locked down, physical health suffers. And of course, it's not as simple as that. So take, for example, there's an area of London where I live where we have strains of the South African variant. And that has meant that a lot of people in their 30s, 40s, 50s with no underlying health conditions have sadly died. Now, I did a virtual talk in a school in that area the other day, and their parents and grandparents, a lot of the children in that class had died. And of course, that impacted their mental health, their ability to engage with their learning, just as much as being in lockdown, if not more. So I think it is, you know, going back to what John was saying, it's about balancing the risks. And I think the most important thing is that we can get schools back open safely, and that's the word that needs to be emphasized. And if you look, the teaching unions, they have suggested a plan whereby we can look at things like ventilation, look at staggered starts, look at class sizes, so that we can ensure that as many children as possible can get back to learning, because we know that ideally that's where they'd be, but that we can kind of mitigate some of those risks. And so I think I'm encouraged to hear what John's saying, because here in England, it's very much like just get them back. That seems to be the message from government. And then the question of how we do that safely has been missing from that rhetoric.
If you don't mind, Natasha, I'd like to come to you for this next question as well. Are you concerned that we are going to see a generation of children with very low self-esteem, seeing as that's something you've written and talked about quite extensively?
Well, I mean, I think self-esteem has been an issue for a very long time. And one of the problems that it is huge within Generation Z is perfectionism. And that's something that I researched quite extensively for my last book, this feeling, and it is magnified by things like social media, this feeling that you have to do everything perfectly, and that if you can't do something perfectly, you shouldn't even try. That's something that is not only affecting young people's ability to engage with their learning, but it's also affecting their mental health. Then you take into account the pandemic, which has increased unemployment, has made the future so much less certain. What does university look like for this generation of school leavers? What do apprenticeships look like? Taking away that certainty is going to affect anxiety levels. And of course, that's going to have an impact on self-esteem, because purpose is a really key human psychological need. So I think what we need to do is we need to paint a picture for young people of what the plan is for the new normal and what their futures might look like.
Ffion, do you have concerns that children your age will grow up with low self-esteem?
Yeah, I certainly do. I don't think this is by any means a new problem that has sort of been spurred on by the pandemic, but again, something that has been heightened by the coronavirus pandemic, as Natasha mentioned. And it is very worrying. You know, we are facing constant pressures as young people, whether that is from social media, whether that is from schoolwork, and again, as Natasha said, really this idea that we need to reach perfection, and it is worrying. But I think that it is something that we can help combat with the correct services for young people and with the correct information and stuff, and perhaps utilising the things that are negatives in young people's lives, such as social media, which can often be a big contributor to low self-esteem, perhaps turning these things into positive things for young people. But again, that is quite a difficult solution in itself, and something that we need to look a lot into, and something that we need more funding for and such.
John, you've already given a brief explanation as to how the government is already trying to tackle this problem. But again, how can the government and the people of Wales really go about making sure that children of this generation grow up with a good level of self-esteem?
Yeah, well, it is a major concern. One of the Welsh Government ministers, Jeremy Miles, has been tasked with looking at how we can build back better, as it's often described, and indeed build back fairer. And, one thing the pandemic has made crystal clear, I think, is that the existing inequalities and unfairnesses in society have had such a marked effect in terms of exposing vulnerability. So those who have suffered most in all ways, including, mental health in its widest sense, are those in the most difficult and most deprived circumstances. So, if we are going to build back better, it has to be fairer. And Jeremy's work is looking at that. And I'm sure it will deal with everything in the round, because he's had a series of meetings with all sorts of organisations right across Wales to get a feel for what the on-the-ground issues are. So, I would hope that as part of that work, these issues of self-esteem, anxiety, and, mental ill health in our younger people are addressed effectively, and those sort of preventative services, the community services, are strengthened. It is going to take a massive national effort, really, to get beyond the pandemic and to deal with all the issues involved. But one thing we have seen is a great coming together, not just within communities, which is so important, but between different organisations, different levels of government, business. And I think that's the spirit that will take us forward.
We'll take some more questions from the audience now. We've just got some coming in here. Recent statistics showed there were more than 100,000 prescriptions of antidepressants in Wales last year, while talking therapies fell. Should we be worried about this? Natasha, I'd love to hear your thoughts on that question.
It's so difficult to talk about SSRIs, which is antidepressants, because it's such a personal thing as to whether they are the correct thing for you. And I know when I've written about antidepressants in the past, I've been really careful to try and tread that line, because for some people they are life-saving and they are necessary. And for those people, there should not be any more stigma attached to taking medication for your mental health than there would be for taking an aspirin for a headache. For some people, it can make them worse, and that can be because they are on the wrong variant of that medication, or it's just not working with them. And then, of course, you have quite a large group of people for whom they are unnecessary or not the correct solution. And my feeling is that we're doing it the wrong way round. So what we should be doing is offering therapy first, and then if the person can't engage with therapy, or if therapy doesn't work for them, then we look at medication. But because services are so stretched, what tends to happen is people get put on a waiting list for therapy, and then they're given medication in the interim to kind of get them through that time.
Earlier today, I was speaking to a headmaster in Cardiff, and he told me that we should wait until children are back in school before assessing their mental health. Ffion, is this really something that can wait?
No, I certainly think that this is something, it is a problem that all young people are facing now. And I understand why some people think that it might be better when we're back in school, because I suppose, people have got more access to be able to speak about their different experiences with mental health and such, but I definitely think it's something that needs urgent consideration now, before we go back into school, so we can assess how going back to school will look, because as John said, this sort of, we don't know exactly how that is going to look, and we haven't heard yet how it will look. And so it's essential that we do look at how young people's mental health is in the current moment, so we can fit that around the way in which we go back to school. Young people have really suffered during this difficult time, and it's essential that we have their interests with regards to their mental health at the heart of all the decisions that we make.
John, this isn't just a problem for the present, but it's also a problem for the future. Again, is this something that can wait?
No, it isn't. It's something that has to be addressed right here and now, as well as, the right plans being put in place so that we've got the right services and the right approach going forward. One thing that we are keen on in Wales is taking a long-term view, and I think that is really important. And we've got legislation in place under the Wellbeing of Future Generations Act with a commissioner to help make it a reality, to take that long-term view. But obviously you also need to deal with the problems of the here and now. I do think that's happening. We have seen services reshaped. We have seen extra funding dealing with the problems as they exist at the moment. But we are going to have to sustain that effort, it's not going to be easy given the economic impact of the pandemic, as well as the social and all the other aspects.
Natasha, do you have anything to add to what Ffion and John have already said?
Well, I think from the conversations that I've been hearing from the NHS and public health experts over here, a big problem that we've got is staffing of services. So you can fund services, and of course that funding is always welcome, but what we need is people power. And I think with so many people finding themselves on furlough or unemployed or made redundant, and so many young people uncertain about what a good career path looks like in 2021, perhaps something that the government could be doing is looking at becoming a mental health nurse, a psychiatrist, or some other type of professional in that area a really attractive prospect, and helping people to retrain, because we're going to need them.
We are nearing the end of our time, but Ffion, as someone who is living through what we're talking about, how are you coping with all of this madness?
Coping has been, I think, one of the most difficult things, because the typical things that young people might turn to, such as speaking to friends, speaking to family members, engaging in different activities, have had massive barriers to them. I personally have tried to cope by trying to continue with these things online. I've been engaging in my dance lessons over Zoom, as well as speaking to my friends via social media. But I think we do have to understand that not all young people have been able to do this, whether it is because of digital reasons. Some areas the Wi-Fi connection has not been great, and different things, people aren't able to engage, but also that idea that it's really difficult to be motivated during this time. And this is something I've really found amongst young people. It's difficult to feel like you're ever looking forward to anything, and then it's difficult to reach out to your friends and speak to your friends, or to engage yourself with these different things. And so yeah, although I've been fortunate in being able to cope by using these different things, I do think that young people on the whole need some support with regards to coping, and I think that schools have been a great provider of that, but we need to perhaps extend that further.
Before we close, I would actually like to end on a brighter, more positive note. What is one thing that you are all looking forward to? What's one thing that's keeping you going? Natasha, I'll start with you. What's that one thing for you?
Well, I was and remain a huge fan of a guy called Ken Robinson, who sadly passed last year, but he was a big voice for creativity in schools and helping people to harness their creativity to make society better. And his daughter Kate has taken over his legacy, and what she said is that we should see this where, we're in a pandemic and everything seems like it's on pause. We should use this as an opportunity to assess what works in our society and what doesn't, and to build back better and stronger. So I hope, certainly in terms of education and mental health services, that we can rise to that challenge. And as Ffion said, putting young people's voices at the heart of everything that we do.
John, what's that one thing that's keeping you going as we seemingly approach the end of this mad 12 months or so?
Well, I think it's light at the end of the tunnel, really, given that we've got the vaccination programme rolling out. Primary school children of some ages starting back next week. We are starting to see an emergence from, the very, very difficult lockdown period. But, communities coming together is really important. The way that neighbours have picked up prescriptions, picked up shopping, communicated with those who are lonely and on their own, and just out walking, speaking to other people at a social distance, all of that sort of mutual support, I think, is getting me and others through these really, really difficult times.
Ffion, you might actually be able to see your friends soon. I assume that's something that's really keeping you going. Yes,
certainly. I myself have not actually been able to see my friends since the 1st of December due to different self-isolation periods and, of course, the current lockdown. And so seeing my friends and doing the things that I almost took for granted, even in the months of September and October after the first lockdown. It's just doing those things that is really keeping me going.
Well, that is all we have time for today. Thank you so much to Natasha, John and Ffion for their time today, and to you at home for watching. Don't forget, you can follow CJS News and all our stories on social media. We're on Twitter, Instagram, TikTok and Facebook at Broadcast CJS. Thank you very much. Diolch yn fawr.